Most heart attacks don't happen without warning. They happen after years, sometimes decades, of silent warning signs that were there the whole time, signs that most people ignored, signs that most doctors never connected to arterial disease until it was too late. The problem is not that the body doesn't send signals. The problem is that nobody told you what those signals look like. Today I'm going to show you 5 of them. They are subtle. They are easy to dismiss. And at least one of them, I can almost guarantee, is something you have already experienced and written off as nothing. Pay attention. This one matters. I've spent over 25 years in internal medicine, and arterial disease, atherosclerosis, is the single most underdiagnosed condition I see in patients who feel completely fine, because that's exactly the point. It feels like nothing, until it doesn't. Today we're going through 5 warning signs that your arteries may already be narrowing, what each one means, why it happens, and what to do about it before it becomes a crisis. Let's start with sign number 1. You walk up a flight of stairs, you carry groceries from the car, you do something you've done 100 times, and you feel more tired than you should, not exhausted, not chest pain, just more effort than expected. Most people blame age. Most people are wrong. When arteries narrow, the heart has to work significantly harder to push blood through a reduced opening. During any physical exertion, even mild exertion, the demand for oxygenated blood increases. If the supply is restricted, the body signals fatigue earlier than it should. This is called exertional fatigue, and it is one of the earliest and most consistently ignored signs of reduced arterial capacity. The critical question is not whether you feel tired. It is whether you feel tired doing things that didn't used to tire you. That shift, that's the signal. If your exercise tolerance has quietly declined over the past 1 to 2 years, your arteries deserve a conversation with your doctor. This sign makes people uncomfortable to talk about, which is exactly why so many miss it. In men, erectile dysfunction that develops gradually, not from stress or psychological factors but consistently over months, is one of the most reliable early indicators of systemic arterial disease. The blood vessels supplying that area are among the smallest in the body. They narrow first, before the coronary arteries show symptoms, before any chest pain appears. Research published in the Journal of the American College of Cardiology found that men who develop erectile dysfunction have a significantly elevated risk of a cardiovascular event within the following 3 to 5 years. In women, the equivalent signal is persistent coldness in the hands and feet, reduced sensation in the extremities, or slow wound healing, all signs that peripheral arterial circulation is compromised. This is not a quality of life issue. This is a cardiovascular warning. You're walking, at the shops, in the park, anywhere, and your calves or thighs begin to cramp or ache. You stop. You rest for a minute. The pain eases. You walk again. It comes back. This pattern has a clinical name, intermittent claudication, and it is a textbook symptom of peripheral arterial disease, narrowing of the arteries supplying the legs. What is happening? The leg muscles demand more blood during walking. The narrowed arteries cannot supply enough. The muscles begin to ache from oxygen deprivation. Rest reduces the demand. Pain eases. The cycle repeats. Most people assume it is a muscle problem, a knee problem, an age problem. It is an artery problem. And peripheral arterial disease in the legs is strongly associated with concurrent coronary artery disease. If your legs are showing this pattern, your heart arteries need to be assessed too. This is the sign that almost nobody connects to their arteries, and it may be the most important one on this list. Have you noticed, over the past year or two, that your thinking feels slightly slower? That you lose words mid-sentence? That concentrating takes more effort than it used to? That you walk into a room and forget why? Most people chalk this up to stress, to getting older, to being busy. But here is what the research shows. The brain is the most blood-hungry organ in the body, consuming 20% of the body's entire blood supply. When cerebral arteries begin to narrow, the brain is among the first organs to show functional decline, years before any dramatic event occurs. A 2019 study in the European Heart Journal found that measurable cognitive decline often precedes cardiovascular events by 3 to 7 years. Your arteries feed your brain. A brain that is running slower than it used to may be telling you something about your circulation, not your intelligence. Not breathlessness from running. Not breathlessness from a cold. Breathlessness doing something ordinary, walking at a normal pace, having a conversation while moving, carrying something light up a slope. When coronary arteries narrow significantly, the heart muscle itself begins to receive less oxygen. Under any demand, even mild demand, the heart struggles to keep up. The lungs compensate by breathing faster to try to deliver more oxygen to an underperfused system. The result is breathlessness that feels disproportionate to the activity. This symptom is more common in women than men, and is frequently misattributed to anxiety, deconditioning, or stress. As a result, women are statistically more likely to have arterial disease go undetected until a serious event occurs. If you are a woman and you have noticed unexplained breathlessness, please do not dismiss it. Get it investigated. If you recognized one or more of these signs in yourself, here is what to do. Step 1. Request a full cardiovascular panel from your doctor. This should include total cholesterol, LDL, HDL, triglycerides, fasting blood glucose, CRP, C-reactive protein, and blood pressure. If your doctor hasn't checked CRP, ask specifically. It is the best available blood marker for arterial inflammation. Step 2. Ask about a coronary calcium score. This is a low-radiation CT scan that directly measures calcium deposits in the coronary arteries. It is the most accurate non-invasive test for atherosclerosis available and is dramatically underused in routine practice. Step 3. Start now on the 4 lifestyle factors with the strongest evidence. Stop smoking if you smoke, reduce added sugar, begin Zone 2 cardio 4 times per week, and bring your resting heart rate below 70. These are not suggestions. For someone with early arterial narrowing, these are interventions with the same weight as medication. The 5 warning signs your arteries may be silently narrowing. 1. Fatigue during activities that didn't tire you before. 2. Erectile dysfunction in men. Peripheral circulation changes in women. 3. Leg cramping or pain that eases with rest. 4. Cognitive slowdown. Thinking, memory, word retrieval. 5. Disproportionate breathlessness doing ordinary things. None of these are definitive diagnoses. All of them are signals worth taking seriously. The body gives warnings. The question is whether you are paying attention. You are watching this video. That means you are paying attention. Now act on it. If this was useful, hit like. It helps more people find this information, and if you're not subscribed yet, do it now. Every week I put out information that your doctor simply doesn't have time to explain in a 15-minute appointment. Take care of yourself. I'll see you in the next one.